Hello, we are P1 pharmacy students at the University of Connecticut. My name is Sarah, and these are my classmates John and Disha, and we will be presenting on glaucoma. As of 2020, 76 million individuals worldwide are affected by glaucoma, and this number is estimated to grow to 111.8 million by 2040. But what exactly is glaucoma? Glaucoma is a neurodegenerative disorder of the eye, characterized by the instability of intraocular pressure, resulting in cell death. Typically, this is because the pressure in the eye is too high, though there are instances where the pressure is normal or lower than usual, which will be discussed later in this presentation. This disease is the leading cause of irreversible blindness. There are two main types of glaucoma, open angle and closed angle. I will also be going over normal tension glaucoma, however, it is not as common. Open angle glaucoma is the most common form of glaucoma, representing 90% of cases. Structurally, the individual's eye has a wide and open angle between the iris and the cornea. Due to this larger angle, the aqueous humor, or the fluid that flows over the eye, keeping it moist, slowly begins to get stuck in the top and bottom angles instead of flowing out of the drainage canals, as you can see in the diagram to the right. Over time, this buildup will block the drainage canals, also known as the trabecular meshwork, and this causes the intraocular pressure to build in the eye and eventually degrades the optic nerve. This condition slowly develops and is unfortunately lifelong. In the beginning of development, however, it is typically painless and causes no vision changes. Some people can lose up to half of all of their retinal neurons before noticing vision loss. The next type is closed angle glaucoma, which is much more serious and requires immediate medical attention by an ophthalmologist. Structurally, it is the opposite of open angle, where the angle between the iris and the cornea is much narrower or closed altogether, meaning that the fluid can immediately block the drainage canals because there's no extra wiggle room for the fluid to flow. This causes a very sudden rise in intraocular pressure with noticeable symptoms and permanent damage if not dealt with immediately. Normal tension glaucoma is much less common than the first two, but does occur. This is where the optic nerve becomes damaged even though intraocular pressure is normal. There is no definitive cause on why this happens, but it's theorized that some individuals' optic nerves are just very sensitive to their eye's unique pressure. Individuals with a higher risk of developing normal tension glaucoma are those with a family history of the condition, those of Japanese ancestry, or those with an irregular heart rhythm. Though we don't have a definitive cause of glaucoma, we do know what risks increase likelihood of developing it. Those over 60 years old are 6 times more likely to develop glaucoma. Eye injuries also increase risk, the most common being from baseball or boxing. Eye myopia or severe nearsightedness, those with a family history, as open angle glaucoma is hereditary. Diabetics are more at risk, as well as those with a thin cornea, less than 0.5 millimeters. Steroid users, especially individuals with high doses, those with high intraocular pressure, and race, specifically those of Asian, Hispanic, and African descent. Asians are much more likely to be affected by closed angle glaucoma because their eye shape naturally creates a narrower angle. Studies have shown that South Asians, Chinese, and Inuit Eskimos specifically have a significantly higher risk of developing closed angle glaucoma. In China, closed angle glaucoma accounts for 90% of all cases of blindness. For the Japanese, they actually have a lower risk of closed angle glaucoma, but a higher risk for normal tension glaucoma. Among Hispanics, open angle glaucoma is the leading cause of blindness. A study, Proyecto Ver, reported that only 38% of Hispanics with glaucoma know they have the condition, while the National Americans Eye Health and Eye Disease Survey found that 76% of Hispanics did not know their ethnicity was a risk factor. The older population of Hispanics is at the most risk compared to those of African and European descent. Those of African descent are also more prone to developing open angle glaucoma. However, theirs developed faster, roughly 10 years earlier, and with a greater rate of blindness than other races. They are 6 times more likely to develop glaucoma compared to those of European descent. The reasoning for this difference is unknown, but genetics does play a role. In a 2015 Nigerian blindness survey, it was discovered that 1.1 to 1.4 million Nigerian adults have glaucoma, with the majority unaware of their condition. In Nigeria, 1 in every 20 Nigerian adults over 40 have glaucoma, with 1 in 5 of them being blind.
Now we will discuss the process of diagnosis and treatment. Here is a list of symptoms for open and closed-angle glaucoma. Open angle is much more common, but much more difficult to detect due to the lack of symptoms. There are very limited vision changes in its early stages. There's also no redness or pain. As the disease progresses, patients may experience the development of blind spots, optic nerve atrophy, and gradual increase in eye pressure. Doctors have a much easier time identifying cases of closed-angle glaucoma. If a patient experiences these symptoms, hazy or blurred vision, rainbow-colored circles around bright lights, nausea, vomiting, severe eye pain, abnormal IOP, or sudden sight loss, and is diagnosed with closed-angle glaucoma, they need to seek care immediately. This form of the disease can result in irreversible damage if not treated. Before any diagnosis is made, it is very important to rule out inaccurate intraocular pressure readings, fluctuations in pressure readings, or damage from any previous ocular disease. Some of these optic neuropathies could be from ischemia, cytomegalovirus infection, or vitamin B12 deficiency. The visual field test can help determine how severe the disease is or side effects that a patient may be experiencing. Ophthalmoscopy allows doctors to get a visual of what is going on inside the eyes. They look for hemorrhages, the state of the optic nerve, and other findings that may be more representative of other diseases mentioned earlier. IOP stands for intraocular pressure. This reading can be determined through a variety of different machines. However, they're not always accurate, which is why it's compared to central corneal thickness to ensure quality measurements. Throughout this process, doctors are looking to see if the pressure is higher than normal. Generally, glaucoma patients have higher readings than normal. Normal eye pressure readings are between 10 and 21 milligrams. However, it's important to consider that the IOP of patients are unique to them. Some patients may naturally have higher or lower eye pressures. IOPs are measured with tonometers. They can be either large machines, as seen in the pictures, or a handheld device. First, the optometrist will numb the patient's eyes with eye drops. After the eyes are numbed, the tonometer will come in contact with the eye and give a reading. Like any machine, tonometers must be calibrated, and the patient has to remain steady to obtain accurate results. This is why eye doctors do not only use this test to diagnose a patient. As said before, there's no singular test to determine if a patient has glaucoma or not. It's extremely important to consider other variables and reasons for potential symptoms before making a final decision. Ophthalmoscopy is a common test done at most eye appointments. After dilating the pupils, doctors can see the shape and color of the eye. This allows them to identify areas of damage, risk of damage, or other concerns they may have. For a patient that is suspect of glaucoma, the doctor will look out for signs and symptoms that do not match glaucoma to ensure that the patient is not experiencing a different ocular disease. The other tests are normally done if the IOP readings are concerning and the doctor believes the patient is suspect for glaucoma. Parametry is a visual field test to identify a patient's complete field of vision. One of the major symptoms from glaucoma, especially in the later stages, are blind spots. This test essentially draws up a map of an individual's vision. This is important after a patient has been diagnosed to track the progress of their treatment. Gonioscopy is a test that determines the angle where the iris meets the cornea. This is important in distinguishing open or closed glaucoma. Once the eyes are numbed, a contact lens is placed on the eyes. The lens reflects an angle of light that allows doctors to identify the type of glaucoma. Tachymetry is another test that is done if IOP readings are slightly abnormal. This test measures the thickness of the cornea. Like the ophthalmoscopy, this test is done to validate the results of the IOP test. Some of the treatments come in either the form of eye drops or surgery. Eye drops are always preferred, specifically with prostaglandins. Beta blockers are your second line, and there's other second line agents such as alpha adrenergic agonists, carbonic anhydrase inhibitors, rho kinase inhibitors, or miotic or cholinergic agents. In the case of open angle glaucoma, eye drop treatments should always be used before considering surgeries. If a patient is diagnosed with closed angle glaucoma, they will most likely have to go straight into laser therapy, which will be discussed later in the slide set. Some of the more common prostaglandins include latanoprost, travoprost, tafluprost, bimatoprost, and latanoprostene bunad. This is a list of common prostaglandin analogs that most patients use. The names within the parentheses are the brand names. Prostaglandins tend to have very few side effects. However, a patient could experience a change in iris color and growth in eyelashes. Change in pigmentation occurs in 15 to 30% of people in the first 2 years. While this does no harm, this color change is irreversible. Some of the more common beta blockers are timolol hemihydrate, beta-taxol HCl, timidol maleate ophthalmic solution, levobutanol HCl ophthalmic solution, and metoprolol. Like prostaglandins, these beta blockers work by decreasing the production of intraocular fluid to overall reduce the pressure in the eyes. Generally, beta blockers are inexpensive, with generic versions being available. However, some side effects include lowering the blood pressure, reduced pulse rate, and fatigue. It also may alter an individual's cardiac activity, especially during exercise. There are two notable alpha agonists, bromamidine tartrate and aproclonidine HCl. Alpha agonists decrease the production of fluid in the eye but also increase its drainage. Alpha-Gin P has a component called purite. This preservative breaks down components that make up tears, and is normally used for people that are allergic to preservatives and other eye drops. Some side effects may be slight stinging when the drug is dropped into the eye, some fatigue, headaches, drowsiness, and dry mouth. 30% of patients have an allergic reaction with aproclonidine, and 8% of patients have an allergic reaction with brimonidine. When patients are prescribed one of these medications, patients must be educated of these potential reactions. Carbonic anhydrase inhibitors also reduce eye pressure, but only by reducing the production of intraocular fluid. Some of the more common ones include methazolamide, dorazolamide HCl, brinzolamide ophthalmic suspension, and acetazolamide. Unlike the previous drugs, CAIs are available as either eye drops or pills. Pills are normally used for patients that do not get better from the eye drops, or the source of glaucoma will not be affected by the eye drops. This also helps with patients that are not adherent to eye drop medication. Some patients may need to take both forms of the medication depending on what their doctor tells them. Currently, there's only one main Rho kinase inhibitor, nitarsodil. It increases the drainage of intraocular fluid by increasing the flow of the trabecular meshwork. Some of the more common side effects include eye redness, potential corneal deposits, and minor bleeding in the eyes. Some of the miotic cholinergic agents include pilocarpine HCl, pilocarpine HCl gel, and carbachol. These medications lower eye pressure by increasing drainage by making the pupil size smaller. Cholinergics can also be used as monotherapy or in combination with other glaucoma medications. However, when the pupil is constricted, less light comes into the eye and patients may experience a dimming effect. While this will not restrict patients from their daily activities, it could make things like driving at night much more dangerous. There are many different types of laser eye surgery. This includes ALT, SLT, LPI, and cyclophotocoagulation. A doctor's decision to do laser eye surgery should not be the first option unless the patient is in a medical emergency, such as diagnosis of close-angle glaucoma, or if eye drop therapy does not work. However, if other therapies do not work, laser surgery could be a potential treatment. ALT opens clogs in the eyes so that fluid can drain out. Normally, this procedure is done in 2 sessions. The first one gets rid of about half of the clogs just to see if surgery helped. This process works in about 75% of patients. SLT is done if ALT does not work. A doctor will beam a low-level laser to spots of pressure. The problem is that this is not a one-time process. A patient will repeatedly have to get SLT to maintain normal pressure. LPI is for closed-angle glaucoma patients or patients that have very thin corneas. A laser makes a hole in the iris to drain fluid and relieve pressure. Cyclophotocoagulation is not a very common surgery. Normally, this is done if other surgeries do not work. A laser is beamed to the structure of the eye that builds up pressure. Like SLT, this will most likely have to be repeated to maintain normal eye pressure. Filtration surgery is done when eye drop therapy and laser eye surgery does not work. A surgeon will remove your natural drain to make a new drain. This allows fluid to flow out of the trabecular meshwork to reduce eye pressure. Overall fluid will be able to drain with relative ease through the new drain. The concern with this surgery is the ability of the eye to heal its resurfaced tissues. Also, this does put the eye at risk of infection. Younger individuals tend to be at higher risk of scarring and overall failure of this procedure. Medicines like mitomycin or 5-fluorouracil are used as anti-scarring medication to reduce the chances of failure. This surgery requires special sedation medications and an eye surgeon. Along with the medications that may be required, the surgery could be quite expensive. This is not a very efficient option for those that do not have insurance. Like filtration surgery, drainage implants should not be done unless the eye drop therapies do not work. Many patients still need to take eye drops after this surgery. Instead of cutting the eye, an eye surgeon will implant a drainage tube inside the eyes to drain excess aqueous fluid. This will overall reduce intraocular pressure. However, like the previous surgery, there's risks of scarring, bleeding, infection, also cataracts, double vision, and vision loss. Normally, the vision loss is temporary after the first few days of surgery.
Now we will be discussing how glaucoma is related to other conditions. We'll be touching upon blood pressure, neurodegenerative diseases, cardiovascular disease, diabetes, and mental disorders. The relationship between blood pressure and glaucoma is somewhat complicated. Very high blood pressure is not good for glaucoma because it may raise eye pressure. However, moderate to very low blood pressure is also a problem because it is important for the optic nerve to receive enough blood flow. Hypertensive individuals are more likely to have an elevated eye pressure due to the direct relationship causing increased blood pressure to result in increased eye pressure. It would also increase the amount of fluid the eye produces and affects the eye's drainage system. On the other hand, hypotensive patients have an increased chance of developing ocular perfusion pressure, which is essentially the difference between blood pressure and eye pressure. Both blood pressure and eye pressure vary throughout the course of the day. Overnight, blood pressure can naturally drop and cause damage to the optic nerve. As such, it is important to strive for an intermediate blood pressure because both hypertension and hypotension are glaucoma risk factors. Glaucoma is undeniably a disease of the eye, but because the optic nerve is part of the central nervous system, one can certainly think of glaucoma affecting the brain. Researchers have found that it shares a variety of features with degenerative brain diseases such as Alzheimer's, Parkinson's, and Lou Gehrig's. In all of these diseases, age and family history are significant risk factors where specific areas of the brain are damaged over time. In glaucoma, the only difference is that the specific area of the brain affected is the eye and the optic nerve. Sources from the Glaucoma Research Foundation report that glaucoma alters the optic nerve and essentially affects the visual cortex, the portion of the brain that allows us to interpret visual input. As illustrated in the image to the left, the optic nerve and visual cortex are intertwined with the inner workings of the brain. And as a result of this relationship, there may be opportunities to develop treatments directed at the retina, optic nerve, and the brain. High risk of cardiovascular disease was observed in subjects with glaucoma through various research studies by Investigative Ophthalmology and Vascular Science, National Health Insurance Database, American Academy of Ophthalmology, and National Health Interview Survey. There is thought to be a positive interaction between impaired autoregulatory capacity of glaucoma eyes and arterial stiffness of cardiovascular diseases. Additionally, glaucoma may result in the development of abnormal blood vessels and insufficient circulation, which may be attributed signs of vascular disease. Therefore, it is important that special attention and efforts are given to prevent cerebrovascular diseases in glaucoma patients if necessary. There is much evidence suggesting significantly higher prevalence of depression, anxiety, and sleep disturbance in patients with progressed glaucoma. The burden of blindness from glaucoma is high. Therefore, people suffering from a serious eye disease such as glaucoma are usually accompanied by emotional disturbances. Patients may develop depression as a result of being diagnosed with such a threatening condition while handling the complicated and financially burdensome treatment options, especially if they lack supportive structure. Anxiety may also increase due to the potential risk of worsening symptoms and possibility of losing sight. Sleep disturbances are also common due to the likelihood of either falling asleep too quickly or taking a longer time to fall asleep. These factors have a snowball effect into other important aspects of a patient's life, creating an overall negative effect. As such, they are less likely to adhere to their medication regimen, putting themselves at greater risk of complications. Moreover, untreated psychiatric illnesses are associated with increased morbidity and increased cost of care. Therefore, it is important for healthcare workers to take a comprehensive approach when treating glaucoma patients to ensure that they receive proper care. A common complication of diabetes is diabetic eye disease. Diabetic eye disease refers to a group of sight-threatening eye problems that people with diabetes may develop. In terms of individuals with open-angle glaucoma, which is the most common type, they are more likely to have diabetes and vice versa. People with neovascular glaucoma, which is a rarer type of glaucoma, usually have other accompanying conditions, including diabetes. In some cases, a diabetic retinopathy may develop, causing blood vessels on the retina to become damaged and produce new abnormal blood vessels. For treatment in this particular case, one option is laser surgery to reduce abnormal blood vessels on the iris and on the retinal surface. Recent studies have also shown some success with the use of drainage implants. Overall, since eye complications are common with diabetes, it is important that people with diabetes get their eyes examined on a regular basis. The National Eye Institute recommends that people with diabetes get a dilated eye exam at least once a year. There are many ways to prevent the onset of glaucoma. We will be discussing healthy diet, exercise, eye drops, eye protection, family history, and examinations. Foods to incorporate for patients with glaucoma are listed in the first bullet. They contain vitamins and minerals that protect your body and the eyes. In fact, studies have shown that these healthy foods are better than oral vitamins at preventing glaucoma. Patients should try to avoid eating baked goods, fried items, butter, dairy, and fatty meats, which are high saturated and/or trans fatty foods. Additionally, caffeine should be consumed in moderation because it can increase intraocular pressure. Regular, moderate exercise may help prevent glaucoma by reducing eye pressure. However, it is important to stay careful and consider the intense exercise that raises your heart rate can also increase your eye pressure. But brisk walking and regular exercise at a moderate pace can lower eye pressure and improve your overall health. If you lift heavy weights, have a qualified trainer show you how to breathe properly during the exercises, and talk with your doctor about an appropriate exercise program. Glaucoma eye drops can significantly reduce the risk that high eye pressure will progress to glaucoma. To be effective, eye drops prescribed by your doctor need to be used regularly even if you have no symptoms. These can help decrease eye pressure by improving how fluid drains from your eye by decreasing the amount of fluid your eye makes. Depending on how low your eye pressure needs to be, eye drops can be beneficial towards patients to help slow down or prevent vision loss. Serious eye injuries can lead to glaucoma. There are many ways to protect one's eyes in potentially dangerous environments. For example, wear safety goggles or glasses during sports and leisure activities. Wear a helmet with a polycarbonate face mask or a wire shield during high-impact sports. Wear safety goggles while using a device that shoots pellets, arrows, paintballs, or other projectiles. Wear safety goggles when handling fireworks. The different types of available protective eyewear are shown in this slide. It is best to engage in safe practices in order to prevent serious injury, which can later lead to chronic conditions. As mentioned earlier, the most common type of glaucoma, primary open-angle glaucoma, is hereditary. If members of your immediate family have glaucoma, you are at much more risk than the rest of the population. Family history increases risk of glaucoma 4 to 9 times. If you're at increased risk, you may need more frequent screening. Regular comprehensive eye exams can help detect glaucoma in its early stages before significant damage occurs. On this slide, you will be able to see the recommendations for a comprehensive eye exam by the American Academy of Ophthalmology based on age groups. If you're at risk of glaucoma, you'll need more frequent screening. Ask your doctor to recommend the right screening schedule for you. In the future, we'll be hosting a live session for potential questions or to clarify any topics that were discussed during this presentation. We have provided the references that were used to compose this presentation for your access. Thank you for listening.